I was a registered nurse for a number of years, and then I just wanted to have a broader scope of practice and a more independent practice. So I went to UBC and did a master's in nurse practitioner. And it's a blend of nursing and medicine. We overlap a lot of what a family practitioner does, and then many nurse practitioners specialize into different areas. I'm trained as a family nurse practitioner, but I did specialize in cardiology. So I have a roster of patients that I follow up on after a cardiologist has had an initial consultation with them. These patients have an issue with their heart. If I need to, I will bring them into the clinic, or currently we've been doing more telehealth with them. I will assess their symptoms. I will order more diagnostics if needed. I will follow up on their lab results. I will increase their medications, titrate their medications based on signs and symptoms of heart failure or fluid overload. Mostly at the end of each day, I want to feel good about each patient that I've had an interaction with, that I've done the best that I can in terms of their safety in their cardiac issues, as well as their quality of life, how they're doing.
Leah has obviously demonstrated her good clinical skills in the clinic over the last 10 years, but I think what people don't realize is Leah's true humanity. She demonstrates this with respect to her patients, her colleagues, and her community at large.
Her patients are always at the center of her care, and she goes above and beyond and always goes extra mile for her patients.
She calls people after hours to check on their status, calls community pharmacies outside of hours again, just to make sure medications are delivered on time. She's gone multiple times out of her way to deliver home blood pressure monitors to patients at their home, deliver medications to patients at their house if they have been bedbound or even during the pandemic, unable to get out of the house. She's been a light for a lot of patients, especially in this last few years.
Leah is always the first person with her patients to find what we call Leah's kitty cash. She will give them a little bit of cash to provide them a meal, a little bit of cash to maybe cover their prescription medications when they can't cover it, or sometimes just to get a taxi home because it's been a long day. And just recently, when a colleague is having a spouse who has cancer, Leah arranged for the clinic to cook a bunch of meals and delivered them to the colleague so that she wouldn't have to think about cooking during this troubling time.
She just truly has a caring touch, and it's not just a job for her. You can tell she truly cares about all the people she works with on such a human level.
Leah has an incredible sense of community. She's one of the first people to volunteer to give immunizations up in some of the Indigenous communities. She also volunteered to help with the migrant workers who came during their isolation periods last year. If she saw somebody on the street or sleeping on the street, she'd be the first person to come up to clinic to find some food, whether it be granola bars or to take them a cup of coffee.
This team that I work with is phenomenal. Like, it's, at the end of each day, I have such gratitude for my colleagues who I call friends. I work with some amazing registered nurses and amazing pharmacists, and I have 3 other nurse practitioner colleagues, and then I have the cardiologists, our MOAs at the front. So we all function really well. We support each other. We are all working towards the common goal of patient safety, patient outcomes, and doing just a really good job. And so that does require a team approach for sure.
Congratulations, well deserved. Happy to have you as a co-worker, as a neighbor in my office, and I hope we still work together for many years to come.
You make coming to work a joy. You make it feel like a little family over here on the cardiac function unit, and I know that patients feel the same. People really feel that you're such a caring person, and you just go above and beyond every day, and it's such a wonderful thing to witness every day.
Leah, we're going to miss you. As many people know, Leah's going to take a job at Home V, so she'll only be with us for a part of her week. But we're so happy that she loved staying with the team so much that she's decided to keep with us, and we want to congratulate her on her new adventure in life. and hope that we can continue to work together for many years.